Ever wonder how you'll spend your later years? Your daydreams are probably filled with relaxing, traveling, and finally being able to get to those adventures on your bucket list. But what about your health? Or have you thought that far ahead? What do you plan to do in your later years, and what concerns do you have for your health?
My goal is really to spend a lot of time traveling and exploring and spending time outdoors.
I guess my biggest concerns for my later years is the quality of life.
According to a new Heart and Stroke Foundation survey, Canadian baby boomers have big plans for their later years and put an emphasis on quality versus the length of time living. The alarming fact, however, is that statistics show boomers should expect to spend their last 10 years in sickness. In other words, the dreams you have for your golden years may turn into nightmares because of ailing health, illness, or disease brought on by our current habits. Almost 80% of the boomers surveyed said they think their doctors would rate them as healthy. But the fact is, 85% admit they don't eat enough fruits or veggies each day. More than 40% say they're not even moderately active, and the majority report being stressed. Cardiologist Dr. Beth Abramson says the statistics are staggering. Canadian baby boomers need to do more to protect their later years so they can enjoy living out long, full lives.
We all know that we should be making healthier behavioral choices, but what we do and what we know are often two different things. Canadians need to realize that we can make small changes in our everyday routine that can have a lasting impact in the future. We can reduce our risk of chronic conditions, heart disease, and stroke. The choice is up to us.
Brian Campkin knows firsthand what it feels like to have a close call. 4 years ago, after feeling terrible shortness of breath on the tennis court, Brian was diagnosed with 3 blocked arteries and had to undergo a life-saving triple bypass surgery. Since then, Brian has made it his mission to turn his life around.
I was stopped in my tracks. Literally, I had to face the fact that I wasn't healthy. I wasn't taking care of myself, and I was really prone to life's common stressors. I actually put everything else in my life ahead of my health. I didn't realize I was putting myself on a pathway to sickness.
Brian's case is not uncommon, but like Brian, most Canadian boomers have the power to change the direction of their health. He's now 20 pounds lighter, he's changed his diet, and today he feels better than ever. Dr. Abramson says she sees cases like this almost every day, but emphasizes that up to 80% of premature heart disease and stroke is preventable.
By addressing 5 controllable behaviors that can affect cardiac risk, Canadians can have a promise of a longer life and vitality. Increasing our physical activity, eating a healthy diet, quitting smoking, managing stress in a healthy way, and only drinking alcohol in moderation can all impact our life in the long run. We can live a longer, healthier, vital life, but it's up to us.
I always try to maintain a positive attitude and a really healthy outlook, and with the information I was provided from the Heart and Stroke Foundation, it really led me to the healthy choices I needed to make. And with that, I was able to actually achieve my dream of walking Megan down the aisle.
For more information on choosing changes today that will make health last for tomorrow, visit makehealthlast.ca.